Welcome to Journey to Joy Live. This is Dr. Enjoy coming to you for my weekly Journey to Joy Live podcast. So, as you know, September is both National Recovery Month as well as Suicide Prevention Month. So, I started out last week, had my wonderful guests, my husband, Juan Mena, on talking about his journey to recovery. Recovery isn't easy, and recovery is different for everybody. So we started out, and I want to finish up that topic today. May take the whole time, who knows? We'll talk about it next. We could get into Suicide Prevention Month next week if I don't get to it, but I imagine I'll get to it today. So anyhow, Suicide Prevention Month and Recovery Month go together anyhow, right? So I talked about it last week, how you can have a substance use disorder, alcoholism disorder, and it may be that a person is treating an underlying mental illness, an underlying sleeping issue, an underlying depressive issue, or anxiety, or whatever it is, and they might turn to a substance to help make them feel better, to help them sleep, to help them feel happy, to help them feel whatever it is not making them be stuck in the rut that they feel as a result of their mental illness. And therefore, if they're self-medicating, they get dependent on that substance. And that dependency turns into addiction and therefore a substance use disorder. So it definitely goes hand in hand. And when mental illness gets to its worst, that's where suicidal thoughts come in. These are uncomfortable topics, but we have to get comfortable talking about them. Because the more we talk about them, the more we can break down this darn stigma. Okay, so let me go through some myths and facts about substance use disorder. One myth is people with substance use disorders can stop at any time. That's not true. They can't just stop at any time. It takes work, and it takes recovery. It takes treatment. It takes an every single day commitment. So maybe for people who stop cold turkey, maybe they've stopped the actual habit or the smoking or the snorting or the huffing, whatever they're doing. Maybe they physically stop that, but there's still physical things going on in their body, physical things going on in their brain chemistry. And then there's the psychological impacts that could go on for years that they're still experiencing. So although for people who stop cold turkey, maybe they stopped, but the damages, the disease is still there. Addiction changes brain chemistry. It changes the way we perceive a reward. The way you perceive, you know how you eat food and it makes you feel real good, or sex feels real good. I was talking about that a couple weeks ago with Dr. Warren. Drugs change that ability to feel the normal high or the normal reward from food and sex. And therefore, it could take years, months and years to be able to feel that normal joy in life again. So it's not quick. You can't just stop at any time. Addiction can create powerful cravings and changes in the brain that make quitting extremely difficult without the proper support and treatment. Another myth, only weak-willed people become addicted. Addiction can impact anybody. It can, regardless of their strength, regardless of their willpower, it's a disease that requires understanding and support. So a lot of people might say, oh, they're just weak. They just succumb to that thing. They can't just stop. Well, I can just, do this and be done. Well, you weren't addicted. You didn't have the disease. So when you actually are addicted and you have that disease and it changes your brain chemistry, it is really hard, and it can affect anybody. Recovery happens quickly. That's another myth. It doesn't happen quickly. I mentioned before that it could take years. So it really takes that commitment. It takes the proper support and treatment. Treatment is a one-size-fits-all. That's another myth. It's not one-size-fits-all. What worked for my husband doesn't work for the next person, doesn't work for the next person, doesn't work for the next person. It's always what works for that individual doesn't always work for someone else. What works for your parent doesn't necessarily work for you or your child if you all are needing recovery. Some people need detox. Some people need inpatient rehab for months. Some people need to stay in Alcoholics Anonymous, going to a meeting every day for years and years. And then some people don't. So it's a lifelong process that requires dedication and time, and it's a journey of healing, growth, and resilience. So it's definitely important to listen in to things like that, know your resources, educate yourself so that you can be there for family, and whatever treatment you need. So my best friend, Jessica Taylor, mentioned on one of the comments last week that Al-Anon. So that is also a form of treatment for family members. So there's AA for people who are going through recovery, or they might be still drinking, but they go to AA, Alcoholics Anonymous, and then there's Al-Anon, which is for family members to have that support as well. So let's get into, let's see, I've got a comment here. Some people can get confused that cold turkey and recovery are one and the same, meaning they don't need recovery. I think I said that right. Yeah, you said that right. Yes, you said that right. So cold turkey is the way they stopped. But yeah, once you stopped, you enter that recovery, but recovery is where the work is happening. And speaking of that, well, what's the opposite of cold turkey? The opposite of that is gradually stopping. For instance, somebody might be addicted to cigarettes, so they smoke a pack a day. And there's some people who stop after they're like, okay, I can just stop smoking this pack of cigarettes. But then others, I think a pack of cigarettes is about 20 cigarettes in a pack. So you might say, if you're going to do it the gradual way, you might say, okay, I'll smoke 19 cigarettes a day the next day for the next week, then 18 cigarettes, then 17 cigarettes, and you gradually go down. Some people might skip every other day and go down. So whatever works. There's also medication that you can take to help with nicotine addiction. So Chantix, Wellbutrin. Of course, you need to see a doctor for that, psychiatrist. Those are medications that are FDA approved for smoking cessation. For alcohol, there's actually medications you can take for alcohol cravings. Naltrexone. Naltrexone is a medication that you can take that can help alcohol cravings, as well as gabapentin. And yes, that is called weaning off. Thank you. So I mentioned naltrexone. There's another medication, Antabuse. There's another word for Antabuse, but this would be for alcohol recovery. The way Antabuse works, and this is tricky, it's not for everybody, is that you take the medication every day, and this is when you have already stopped drinking alcohol. And it stops you from drinking alcohol because when you do drink alcohol while taking the medication, it makes you feel sick. And so the idea is that you will associate that sickness, that nausea with alcohol, and then no longer want to drink it. It's tricky because some people just decide, well, I'm not going to take it for a couple of days, so it's out of my system, and then I'll start drinking again. So, like I said, it's different for different people what kinds of treatment that you go into. Opioid use disorder, Dr. Warren and I were talking about a couple weeks ago, that there's medication-assisted treatment programs where you can take an opioid-based medication that can help curb the cravings, help you wean off. The idea is that you're not on it, and those meds are methadone, Subutex, buprenorphine. The idea is that you're not on those medications for a lifetime. It's just to help you wean off of that opioid that you were dependent on. And yes, methadone, those are medications you can take when you're pregnant because sometimes, a lot of times, there are women who are addicted to opioids and they need to recover. And so using a medication for assistance is good. Yes, there are times when the baby, when they're born, they were dependent on that opioid, that methadone that you were taking during pregnancy. And so there is something called neonatal abstinence syndrome, where a baby can be born and have like shakes and different things like that. And they need to be monitored in the NICU. At the end of the day, that is better than continuing to use perk or heroin or whatever that is during pregnancy. So that's actually, it is sad. It's sad. But that's a better route. But that's just to show how complicated recovery can be and how it is just different for different people, and how to come off. So I mentioned, let's see, nicotine, how to get off of that. There's different medications. Alcohol, there's different medications that you can use. Do not start off with CBT. Oh, do you start with CBT? You mean cognitive behavioral therapy? Because that's what CBT, or do you mean cannabis? Because cognitive behavioral therapy is a great therapy. It's a great therapy to use when it comes with, I'm about to say marijuana use, because you had me thinking about CBD. Cannabis. Yes, cognitive behavioral therapy, because that's part of the recovery, is trying to change your thoughts. Cognitive behavioral therapy. Cognitive means thoughts. Behavioral is your behavior. The idea is that there's a triangle between how you think, how you feel, and what you do. So if you have a craving and you look at your pen, and that pen, for some reason, reminds you of that drug you used to use, cognitive behavioral therapy can help you reframe those cravings and reframe those thoughts so that that thought won't lead to this emotion that leads to your drug use. So it's important to do therapy along with your recovery with that medication. So all the things. Yeah. Thank you. And yes, triggers, cravings. Those are all the things. So I'm trying to think of what else I was going to talk about with Recovery Month. I think I'm ready to wrap that subject up, because let's talk about what happens when someone who, while they're recovering, maybe in that disorder or some symptoms pop up while you're recovering, right? So remember, for some people who started using that drug, it was because they were depressed, or it was because they were anxious, or they had something going on. So as they enter that recovery, those symptoms are popping out now. And so they go through guilt or cravings, or like feeling unloved, or self-esteem issues, or not wanting to be here anymore. So that's our segue into Suicide Prevention Month. Let's go ahead and start with that. Suicidal thoughts can happen for any reason. It can happen because of what I just mentioned, being associated with drug use, being associated with alcohol use, or being associated with any mental illness that someone might be covering up by substance use. Or it can just be that, they weren't even addicted to anything, but they have depression, they have major depressive disorder, or anxiety, or whatever they might have. And it's really important to understand the signs of suicide. I mentioned in an earlier podcast that there's different types of suicidal thoughts. There's the passive thoughts, and then there's the active thoughts. Some people like passively think about it. They're just like thinking about, I just want to go to bed and I wake up again. I want to escape my problems. I don't want to be here anymore. Maybe I won't be a burden if I wasn't here. Those are passive. They're not going to do anything about it. But active thoughts like, I want to die, I want to kill myself, and they're making plans for what to do to take themselves out. That's more active. One's more serious than the others, but they're both pretty serious. So let's get into some stats here. The CDC says that in the U.S., that suicide was at an all-time high in the year 2022. There were 50,000 people who took their own lives, which was actually a 3% increase compared to in 2021. So clearly the mental health crisis is real. And here in Georgia, specifically, suicide is the 12th leading cause of death and the 3rd leading cause of death for children ages 5 to 17, according to the CDC in 2021. Death by suicide impacts all ages, races, genders, socioeconomic backgrounds, anybody. And notice how I said death by suicide. let's start to use that as opposed to committing suicide, because there can be a negative connotation to committing suicide because it kind of sounds like committing a murder, or that there's like that there's just this. Let's start using death by suicide. That sounds better and it's more softer. And we do know of many people in the media where this has happened. Robin Williams, Naomi Judd, Twitch, the Bears football player, Dave Dorson, a lot of different people in the media. So I know that it can be hard because it's in the media, and it makes people feel like because it's happening in the media, it's going to make someone think about it. Or because I ask the person about, like, are you suicidal, that it's going to make them want to be suicidal because you asked them. But that actually isn't the case. It's important to still ask somebody if you feel like there's something going on with them, or if they're thinking a certain way, or they've changed, they have isolated themselves, withdrawal, that used to be hanging around friends and they're no longer hanging with friends, not showing up at work, or seeming depressed. You want to ask them. And some parents might say, well, I don't want to ask my child if they're suicidal because then that'll make them suicidal. No, that's not the case. Or you don't want them to know the word suicide, or you don't want them to know the news. That is not what's inputting in their head. If they're suicidal or they're depressed, they're going to be suicidal anyway. You can't just give them that idea. So what I'm trying to say is asking that person. Research shows people who are having thoughts of suicide feel relief when someone asks them in a caring way. Findings suggest acknowledging and talking about suicide may reduce rather than actually increase suicidal ideation. Right now, I'm looking at the 988 suicide crisis line. It's 988lifeline.org. So I'm looking at that. I'm showing you what you can do to start that conversation. So the first thing that they talk about is ask. And speaking of which, 988, that's the suicide crisis line. You can text that line, you can call that line, you can chat with someone. So it's like 911, but it's 988. It's very easy to remember. So the second thing that they talk about, be there for that person. Don't leave them alone. Sometimes people, I don't know what to say. I don't know what to do. Just be there. Individuals are more likely to feel less depressed, less suicidal, less overwhelmed, and more hopeful by just speaking with someone or being there and feeling heard. Someone who's listening to them and someone who's not judging them or looking down on them. It is very hard when someone tells you, well, I'm thinking about taking my life, especially if you don't know what to do. So one thing you know right now is that being there and asking them, that's one thing to do. Calling the 988 number. In Georgia, there's a Georgia Crisis Access line that you can also call. I used to know it by heart. I'm going to put it on my comments later. 1-888-715. Yeah, okay. I'm going to put it on my comments later. The third thing, keep them safe. A number of studies have indicated that when lethal means are made less available or less deadly, suicide rates by that method decline, and frequently suicide rates overall decline in general. So that's the thing. When I'm seeing a patient, I take consults in the ER. So if I see a patient in the ER and, they're suicidal, or they've talked about a plan of what they're going to do to hurt themselves or kill themselves, or even outpatient, I talk to parents about this, or the patient about what to do. The number one thing is whatever the plan that they might have, get rid of it. Lock up the knives, ropes or belts or things like that. I mean, usually when it's to this point where they have a plan, they need to most likely be admitted anyhow to the hospital. And I know that sounds scary. And I know sometimes that isn't the best method, because some people talk about how they've gotten worse by being in the hospital because they were away from their family. So again, that is even a case by case. The treatment is not one size fits all. It's the same thing with recovery. So keeping themselves safe, making sure they don't have access to sharp objects, or to their pills, to their medication, because maybe their plan is to overdose. So keeping that away and being there, being that person to give them their medication one at a time. Help them stay connected. Suicide or studies indicate that helping someone at risk create a network of resources and individuals for support. And safety can help them take positive action and reduce feelings of hopelessness. So that connection, feeling like they belong. And a lot of people who are suicidal or feeling depressed, their thoughts tell them that they're a burden to family and that they shouldn't be around them. So it's important for you to be around them and reach out to them so that they can realize, no, you're not a burden. And I tell my patients all the time, oh, hi, Ivy. I see you say hi. It's nice having people on the college. But I tell people all the time, you're not a burden. It's the thoughts that depression is telling you. Depression leads to different thought traps, cognitive distortions. Cognitive distortions is the word, but thought traps. I like to say that because that sounds better. That those thoughts tell you that you're a burden, or they tell you you shouldn't be here, or they tell you you're a failure. So the same way that you listen to negative thoughts, it's important to switch over to those positive thoughts. And that goes back to the cognitive behavioral therapy that I talked about earlier. I was just telling somebody that negative thoughts work, right? You have negative thought, and that negative thought says you're a failure, or that you're inadequate, or that you shouldn't be here. That works. It's going to make you feel sad. It's going to make you feel like you shouldn't be here. It's going to make you feel like nobody wants to be around you. But guess what? The same way negative thoughts work, positive thoughts work too. The more you have positive affirmations and you tell yourself, I am amazing, I'm a winner, I'm strong, I'm independent, I'm blessed, I'm loved, I am not a burden, that is going to make you feel like you are not a burden and that you belong here. So it's really important to have those positive thoughts and to have tell yourself positive affirmations. If it's not okay to talk down to somebody else, why is it okay to talk down to yourself? See, think about that. I say that a lot to people too. But yeah, so Suicide Prevention Month, that's where we're on right now. We have to talk about it. We have to not be scared of what to do or what to say. Sometimes just listening and having an ear is all that they need. Let me make sure I've gone through everything that I wanted to go through. 988, yay. I talked about that. So, a plug for Chris 180. I talk about Chris 180 a lot, but that's because that's my main job. So, I'm going to talk about that. I'm Dr. Minna at Chris 180, and at night, I'm Dr. Enjoy. But guess what? Chris 180 is doing suicide prevention training for anybody and everybody. You don't have to work there. You don't have to be a licensed trained counselor. You could just be anybody that's anybody that's anybody. You can go to these trainings. It's called QPR training: question, persuade, refer. And those three things, question, persuade, prefer, are 3 life-saving steps that anyone can use with another individual who may be contemplating suicide. QPR is a nationally recognized training program that teaches anyone how to use these steps. So we should be attending this training, of course, in order to help ourselves or help someone else out in need. Because I'm sure, like, whether it's in the media or at work or our family members or someone we know, I'm sure we all unfortunately know someone who's had these thoughts. So wouldn't it be nice to know what to do, what to say? So QPR training offered by Chris 180. You can sign up for the training for free at chris180.org. That's CHRIS 180.org/QPR. It's a 1-hour training. In fact, tomorrow they have a training at noon and at 7 p.m. I'm going to be at the 7 p.m. one. And then they have trainings on the 20th as well. So that is important. I think I'm seeing twin sister that suffers from depression, suicide thoughts. She definitely stays away. Sorry, it disappeared. She definitely stays away from our entire family. We try so hard to let her know we love her. Yeah, it's hard because she stays shut down. And you know, I see that in my patients too, because there's a lot of patients that might say, "Oh, I think I'm ugly. Oh, I'm awful. Oh, I'm this, I'm that." And you know, I just want to tell them, "You're beautiful, you're smart, you're this, you're that." But that's the thing about depression, is that it doesn't matter what you say. They're still going to feel that way. And it's that ongoing extended therapy that they need that's going to help them process those thoughts and learn how to love themselves. But depression's a disease too, right? So calling it a disease, calling it what it is, so you can know that it needs treatment. Because the same way that myth with recovery or with addiction of, oh, you're weak. No, 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 no. You're not weak because you became depressed. So let's nip that in the bud right now too. But yeah, it gets hard when the person seems like they're not listening or continues to feel unloved and you feel like you're not doing anything. But that's why it's important to educate yourself and to really understand what it is that you can do, because you can be a part of saving their lives and a part of ending suicide. Thank you for your comments. And you said she's in and out of therapy. So that's the thing, is that therapists are human too. And finding the best therapist is like how you go out looking for a date, right? And finding the right therapist. You want to find the right mate for yourself, the right husband, the right spouse, the right partner. You also want to find the right therapist. Sometimes you got to go through 8 therapists before you find the right one. So I wonder if that's what she's going through too. But I try to encourage people, try again, because maybe you just haven't found that right fit. It sucks, especially when you have to keep telling your story to different people. But it's worth it so you can find the right person. Or if therapy alone isn't working, then medication can also help. And it's not just about medication and therapy. Those are evidence-based strategies that do work, but it's also other lifestyle changes, like making sure you eat healthy, exercise, exercise, exercise. Ask my husband. Exercise is my medication. I have to exercise every night. I don't end up exercising every night, but I know that I missed it the next day when I'm more irritable or anxious, or when I can get more overwhelmed easily. So sometimes those supplements or exercise or taking fish oil, whatever it is for you, can help. Making sure you get enough sleep. So what do we do then? What if they aren't ready to reach out? Or what if they're not ready for you to reach out to them? Just continue to be there. Continue to stay present and let them know, like, you know what? I can tell there's something going on. I'm not sure if you're feeling depressed, but I learned about this resource. Why don't you contact them? I can contact them for you if you want, especially if you're willing to contact them. Let them know that you're willing to help. Because when you're depressed or suicidal, you're not trying to do anything. You want to die. So making a phone call is hard. Going to work is hard. All that's difficult. So if you're there for them to help, then that is important for them. So staying connected with them and making them feel like they belong. Obviously, not all this is on you. If it becomes a burden to you, getting your own support is important, but it's just nice to educate yourself. Whoa, I didn't even think I was going to get to 30 minutes today. You guys, thank you so much for watching and for all of your comments. And thank you for being so transparent and talking about, your sister, talking and asking questions about different things that are going on. Because that just shows that it's true. It happens to us all. It happens to people that we know. And I appreciate you for being here. Share this with others so that they can know. Again, chris180.org/QPR. Sign up for a free training. Thank you for signing up. I see that. Yay. All right, you guys. I'm going to be here next week. Well, every week. Thursdays at 7 p.m. So next week, I'll talk more about Suicide Prevention Month. Like I said, I'm attending that QPR training. It's a free training anyway. So, whatever I learn, I can teach here too. So if anybody misses it. And I plan to have a guest in 2 weeks. She's a child psychiatrist as well. And we'll have conversation about just everything we talked about this month. Thank you, everyone. Have a great week.